Hi Wade, I'm Mark.
I'm Pat.
And I'm Phil. Today we're going to be talking about the Rotator Cuff. We'll tell you everything you need to know and more, or we'll fill your head with the nonsense. GH joint is made up of a large humeral head and a small glenoid fossa from the scapula. It's commonly known as a golf ball on a tee, as the humeral head compared to the glenoid fossa is a 4:1 ratio in size. So what this does is it makes a very incongruent joint, meaning that there's not much bony articulation, and that leads to its instability. To address this instability, we have a large network of ligaments and muscles. The muscles are mainly the rotator cuff, where we have the supraspinatus, infraspinatus, teres minor, and at the back, which we can't see, we have the subscapularis. Supraspinatus, this one up at the top above the spine of the scapula, is responsible for the first 15 degrees of abduction before the deltoid takes over. The infraspinatus is responsible for external rotation of the humerus, and as well as teres minor, they do the same, although teres minor is more active when the arm is up at 90 degrees. Yep. And lastly, subscapularis is responsible for internal rotation, and as we said before, they all play a role in stabilising the GH joint.
So now we're going to talk about how the rotator cuff is injured. Like any injury, there can be a few different ways. Most commonly, however, is the rotator cuff is injured chronically, so it's due to repetitive overuse in things that require movements above the horizontal, so anything where you bring your arm into a movement like that. So it's commonly seen in sports like baseball with the pitches and swimming. And often if you put excessive strain on the four muscles in the rotator cuff, it can lead to an acute tear. But however, this is less common than the chronic. The rotator cuff can also be torn by ways other than sporting injuries or repeated stress. This can be known as impingement syndrome. Impingement syndrome works when the supraspinatus tendon runs beneath the acromion, and when the supraspinatus muscle activates and brings the arm into abduction, it becomes pinched underneath the acromion. This can be due to a number of different reasons, and you can see on this picture, if the acromion is thicker, it's going to irritate the supraspinatus tendon because it runs underneath it. And if they're similar to that, if there are spurs underneath the acromion, then that will lead to irritation as well. In sports that do require excessive motions, there can be a muscular imbalance within the GH joint, and this can also lead to irritation of the muscles. And also, the last one, if the bursa does become inflamed, it's known as bursitis, and that can irritate the rotator cuff. So we can see the acromion here, and if there are bony spurs, when the arm does come into abduction, it will cause irritation of that supraspinatus tendon. The rotator cuff is a very common injury. There have been a few studies that have examined the prevalence and incidence within the community. One study found that due to things such as degeneration, that rotator cuff injuries increase with age. So there are a few recent studies that also showed the prevalence of rotator cuff tears within the society. Yamamoto did a study in 2010 that examined the prevalence of these tears within a village population. Of these results, he examined 1,366 shoulders, and he found that there was 20.7% of the population did have a rotator cuff tear. And he attributed these to, so that if you had a history of trauma, if you were dominant, so if your right hand was dominant, there'd be more chance of a tear in the right rotator cuff, and the risk did increase with age. There's another study done on cadavers in 1991 by Jerosh, and he found that out of 122 specimens, the incidence of partial tears was 28.7%. and the incidence of complete rupture was 30.3%. And consistent with the other findings of the experiments, the frequency of rotator cuff tears did increase with age. So there are plenty of sports where the rotator cuff does get torn, and so as I previously mentioned, any sports that have motions above the horizontal will lead to rotator cuff tears, and swimming is a very common sport where this occurs. It's most notably in the recovery phase. It puts the most stress on the rotator cuff when the arm is abducted, because that can pinch the supraspinatus tendon. And so this is often attributed to a poor technique, and also another way that the swimming affects the rotator cuff is by when swimmers have unilateral breathing, so they'll only breathe to one side, because this can create a muscle imbalance. Stop. We can see in the recovery stage, when the arm becomes abducted, the supraspinatus tendon will become pinched against the acromion, and this can lead to rotator cuff injury. Another sport where we do see rotator cuff tears is in baseball, where there's, especially in the pitcher, where there's repetitive throwing. In the phases of the throw, the most common times to tear the rotator cuff is in the late cocking phase, when the subscapularis muscle acts as a dynamic stabilizer, and in the follow-through phase, where the supraspinatus muscle contracts to decelerate the throw.
Depending on the extent of the injury, will depend on the implications involved. During a small tear, there will be some mild shoulder pain and maybe some clicking within the joint. If it's a large tear, there will be severe shoulder pain, and the elbow won't be able to be lifted away from the body. A severe rotator cuff injury will require surgery. The most common type of surgery undertaken for the rotator cuff is through arthroscopy, which is done through a small hole through the shoulder, which during this time the reattachment of the tendons will be reattached together, and then the healing process will take place.
Unhealthy tissue and repair the torn tendon. Next, your surgeon will drill a few small holes in your bone, wherein implants, called suture anchors, will be placed. Your surgeon will loop sutures through the anchors and stitch them to the repaired tendon to reconnect the tendon to the bone. The anchors and sutures will gradually be absorbed into the healing tissues.
Post-surgery or post-injury, it's very important to have a thorough rehabilitation process to stop recurrence of the injury happening again. Each exercise program is designed for each individual depending on the extent of their injury and how well the surgery went. It's important when recovering from a rotator cuff injury that the purpose is not to overstrain the muscles, however it is to have a high repetition to get that muscle memory back in and strengthening those muscles. The aim of it is to target the four main muscles of the rotator cuff, which we mentioned earlier, through abduction, internal rotation and external rotation.
Here we have internal rotation of the rotator cuff using a resistance band. Normally at the start of our exercise program we will have no resistance, and as we build up through our program we'll add extra resistance and then eventually add weights into the program.